Let's start with the main ways infectious diseases are usually spread. They can be transmitted through air, saliva, blood, or through direct contact with skin. They can also spread via urine and feces as well as through contact with solid, dirty, or unhygienic objects. Understanding the route of transmission is the first step in knowing how to protect ourselves and others. Some diseases can spread through the air, often when an infected person coughs, sneezes, or even talks. Examples include chickenpox, the common cold, diphtheria, flu, measles, meningitis, mumps, rubella, strep throat, and tuberculosis. Airborne droplets can travel 3 to 6 feet, which is why distancing, masks, and good ventilation are important preventive measures. Certain diseases can be transmitted through urine and feces, especially in situations where hygiene is poor. Examples include hepatitis A and meningitis. Proper sanitation, hand washing, and safe food and water practices are critical to prevent these types of infections. Some of the most serious infections are spread through blood and other body fluids. This includes hepatitis B, hepatitis C, and HIV. Transmission can occur through used injection devices, needle sticks, or broken skin. This is why safe handling and disposal of sharps and proper use of PPE are so essential in healthcare and other settings. PPE stands for Personal Protective Equipment. It includes anything used to decrease the risk of harm to workers by preventing contact with infectious agents. PPE acts as a barrier between the worker and airborne, droplet, or contact-spread pathogens. The ultimate goal is to reduce the risk of touching, transmitting, or being exposed to infectious materials. There are 3 main levels of protection: contact, droplet, and airborne. The type of PPE depends on the situation. This may include gloves, gowns, or protective clothing such as aprons, head coverings, and shoe or boot covers, masks and respirators like surgical masks, N95S, or powered air-purifying respirators, eye protection such as safety goggles or face shields. Using the correct PPE for the correct situation is key. For droplet and airborne precautions, we focus on 3 main points. First, exposure. Identifying how someone might come into contact with the pathogen. Second, type of illness. Understanding which diseases require these precautions. Third, method of transmission. Determining whether it spreads via large droplets, fine airborne particles, or both. This information guides the choice of PPE and infection control